So let me update everybody on the health crisis currently sweeping the nation. Here are some numbers for you as of last night. This is as of last night. It almost certainly has gone up since these numbers came out. So the total cases in the world, 339,474. Again, these are official cases. That's very different from what's called true cases. True cases is significantly higher. These cases are just the ones that are tested for and verified. Deaths, there's been 14,502. Recovered, 96,661. Unresolved, 228,311. Then you go down the line there. See, China still has had the most cases, 81,000. But they're now on the back end of the outbreak. As you can see, there's only 46 new cases in China. So effectively, their complete and utter lockdown has worked. It's worked. So now, because they shut everything down completely and stayed in that position for an extended period of time, now life can slowly but surely come back to normal, whereas other nations dragging their feet and never really doing a lockdown means we're going to have a prolonged and perhaps a more deadly situation unfold here. And then also you have to keep in mind, population density. How many people are in China versus Italy versus the U.S., and so you could determine, if you do the math on it, just how bad the outbreak was per capita. So China had 81,000 cases total, only 46 new cases. Italy, 59,138 cases, and new cases, 5,560. So even with the lockdown, you're seeing, some pretty terrible numbers, but it could just be because there's a lag in the testing. New deaths, 651 new deaths in Italy. By the way, the death rate in Italy, look at that, higher than anywhere else, 9.26%. That's the highest in the world by far, even surpassing Iran, and Iran is not, taking the same kind of preventative measures that many other nations are taking. So why is that? I mean, I'm not an expert. If I had to guess, maybe it has something to do with the fact that the population is generally older. There's also a lot of smokers there. It also could be that they actually have very good data that they've been keeping, as opposed to some of the other places perhaps don't have as solid data. Or there could be something that genetically affects certain populations more than other populations. Again, I'm just guessing here. I'm not a doctor. I want everybody to know up front, I'm not an expert on this stuff. I'm just a dude talking, but I'm trying to give you the information and attempt to make sense of it. But there has to be some reason why the death rate in Italy is nearly 10%, whereas, the rest of the world, it's a lot different. I mean, so next, look at the U.S. You got 34,532 cases. 8,500 new cases, so we're just absolutely skyrocketing now on an insane trajectory. Deaths, 393. New deaths, 85. And they say that our death rate, percentage of deaths, is about 1.14%. By the way, a point that, was made by a doctor, an expert on this, is that there's no like set number. That percentage when it comes to death it's fluid and it can change, and a lot of it has to do with the availability of ICU beds and care. So if your health system is overburdened, your death rate is gonna go up, because there are people who would otherwise be saved who aren't saved because perhaps we don't have a ventilator and we don't get them help in time. So it's not like a stagnant number that you could give, which is why you see the death rate, kind of varies from place to place. So anyway, as far as the United States goes, we are in trouble because we're just getting started. Andrew Cuomo said, 3 to 5 days ago that the peak of the virus, at least in my state in New York, is going to be in 45 days. So now 40 to 42 days. It's still that far away, which is a scary thought, because I know, because I have a friend who works as a doctor in New York City, that he's saying our hospital's already overburdened. We're already short on certain kinds of medicine. We're already short on ventilators. Like, they desperately need support. They need help. And Trump enacted, I forget the name of the act, but it's an act that's a wartime act, which allows the president to compel private businesses to make certain things that are needed. So, in theory now, he could say, okay, I need whatever car manufacturers are left in this country. I need you to suspend work on the cars and start pumping out ventilators. And they would have to do it. So I'm happy he invoked that act, but as we're going to get to later, he invoked the act and then didn't do any specific orders to make specific things, whether it's masks or ventilators or anything else. So he's just kind of sitting back as this thing is still unfolding, and that's mind-boggling. So he definitely should invoke the act and get specific as to which plants make what things and, get to work, man, because what's happening is we are waiting until everything is already too bad to then act. Like we needed a total lockdown, going back to March 1st. And unfortunately, everybody's dragging their feet. Like Andrew Cuomo is getting a lot of credit now for being, going around and playing Mr. Bossman and, acting like he's got everything under control. He's doing these daily press conferences where he's given the specific numbers. He's given specific directions. He's acting like a leader. He looks like a leader. But everything he's doing is too late. Like, he needed to do all this stuff 2 weeks ago, at least. So, I think the praise is a little overboard because we're going to see how bad it's going to get, which leads to my next point, which is exactly how bad it's likely to get. Now, these are projections, by the way. This website, covidactnow.org, I highly recommend everybody go to it. You could see the list of the experts and the doctors who've endorsed this model. So that leads me to believe there's some degree of consistency in this model. There's some degree of accuracy in this model. And even if it's off, perhaps it's not, off enough to make that much of a difference. But you could look state by state to see just how bad it's going to get. And what I just pulled up here is my state of New York, and we're the hardest hit. We're ahead of a lot of other states at the moment. Washington was also very bad, but New York is just getting obliterated right now. But you can see that black line represents the number of hospital beds we have in the state. And you see, the different colors. So the red, the orange, and the turquoise, that represents different approaches that we could have taken. The red is no action. What would happen if we had no action? And the red spike there represents the number of hospitalizations. So we'd be talking about over 400,000 people in New York needing hospitalization, and we only have, a few thousand hospital beds. Again, that black line at the bottom represents hospital beds. So you want to talk about an overburdened healthcare system. That would be impossible to accommodate. Now, then you have the option of 3 months of social distancing. And, okay, it's better, but it's not that much better because you're still talking about, about 150,000 hospitalizations that are needed. And again, you could see how low that black line is. So the healthcare system and the number of beds is still being massively overburdened. Then you have 3 months of what's called a shelter-in-place order, which hasn't been done. We're kind of taking a middle approach now where in New York, all non-essential businesses are shut, all essential businesses are open, and the government is just saying, hey, you have to stay in, if you can, by any stretch of the imagination, make it so you can stay inside, stay inside. And it's hurting economically, of course, but it's absolutely necessary. But, with an approach like that, 3 months of shelter in place, you can see we would barely keep it under the number of hospital beds that we have, and we maybe wouldn't overburden the system. And then at the very bottom, you can't even see the line. It's 3 months of Wuhan-style lockdown. So total lockdown of society would have definitely kept us under overburdening the healthcare system. But, and here's the scariest point, guys, and this is what I mean when I say everything was too late. They acted too late. For New York, the point of no return, which means, okay, if you act in this window, then it's possible you'll avoid overburdening the hospitals and overrunning the hospitals. The point of no return for New York was March 13th to March 18th. So we didn't act in time. So everybody was dragging their feet. Everybody was la-di-da. The thing is spreading, and we're acting like, well, we only have a couple cases that have been proven that have been tested in the hospitals. And so they act like, it is what it is. Let's see what happens. And then as the cases skyrocket, then the respective governors, and Governor Cuomo in New York is like, all right, yeah, we got to act. You had to act a while ago. When you start seeing cases where people are being tested and, it's proving that they have it, for every one case of somebody who's an official case, how many thousands of people are out there who have it and are in the early stages, who have it and just think it's, a cold or the flu and they're staying home, who have it and have been spreading it, who are home and who are very sick but haven't gone to get tested yet and haven't been hospitalized yet. You have to assume that when you have one case that you've officially tested for, that there's so many people who have it and are currently spreading it. So that's when you lock it down skis. But they didn't do it. They dragged their feet. New York dragged its feet. Forget it. The federal government, with Trump and all his merry band of idiots, was out there downplaying the virus in January, in February, in early March. It took Trump until like March 15th. And again, we'll get to a segment on this later. I'll give you the video. It took Trump until like March 15th to be like, yeah, this is a pandemic, and I've always thought it was a pandemic. Cut to video of him like, it's just a flu, everything will be totally fine. We have 15 cases, it'll be 0 very quickly. So, this is devastating. Now, I want to tell you guys, go to covidactnow.org, look at your state, and it'll give you the point of no return for your state. So the governor needs to act before the point of no return. Some states are lucky enough where they still have time before they hit the point of no return. So if there's a lockdown ordered or, a shutting of non-essential businesses and everybody kind of stays in place as much as possible, it's possible that you won't overburden your respective healthcare systems, but they have to act like now. There's not that much time left, even in states that aren't too hard hit at the moment, because every state has some cases. Now, the final thing I'll show you is this. This is terrifying. So this lays it out for you here, the scenario. If we did no action in New York, okay, the estimated date for hospital overload is March 27th. March 27th, which is very soon. It's in a week. Now, I have to tell you, less than a week, I should say. I know because I have a doctor friend in New York City, and his hospital, he says, is basically already hitting that point of no return. It will very soon, it will probably hit it on the exact day that they're predicting if we took no action. So our late action is functionally like no action. So, and this is, again, firsthand from a doctor in the city who's saying we're in big trouble. So, kind of like a worst case scenario. In that situation, what are the estimated deaths in New York alone? 392,000. It's possible that as a result of this virus, in New York alone, you have 392,000 deaths. And then you see the other options there as well. What if we just did 3 months of social distancing? Then New York hits overburdened hospitals on April 3rd. You have 292,000 deaths. What if we do 3 months of shelter in place? Then you have, it says it's outside the time bound. So in other words, it's already too late, I guess. The estimated deaths would be 50,000 if we did 3 months of shelter in place. And then the final option, which again, it was too late for, but 3 months of a Wuhan-style lockdown, if we had done that, we could have had only 4,000 deaths. It feels messed up to say only 4,000 deaths, but, that compared to 50,000 or compared to 292,000 or 392,000, I mean, what do you want me to tell you? It's so much better. So, unfortunately, what we're looking at is a situation where we'll almost certainly have deaths in the hundreds of thousands. And that's not me speaking. That's this model, which is endorsed by a number of experts and doctors. And again, you can go to the website and you can see the list for yourself. But it's really not good. And we're acting way too late. And we're dragging our feet way too much. And I can tell you this right now. Every governor who hasn't needs to immediately lock everything down. Immediately lock everything down. And the federal government better get on it, producing emergency ventilators, producing masks. we do need a wartime mobilization effort because we need to increase the number of hospital beds in every major metro area in the country. We have to do it. We have to do it. And that's the only way we get ahead of this enough to actually keep it manageable, not overrun the hospitals, and keep the death tally down. Because ultimately, it's going to be really, really ugly because we're handling this like total amateurs. When you look at a place like Taiwan or Singapore or South Korea, they had such strong measures in place, and they've had outbreaks previously, so they kind of knew how to deal with it and what to expect, that they kind of nipped this thing in the bud. Whereas with us, I mean, dragging our feet massively, not listening to the experts, acting way too late, doing half measures like crazy, you can't half-ass it when it comes to a freaking pandemic virus. So we're about to experience a lot of pain, and I hope everybody out there stays safe. I hope you social distance as much as possible because it's needed.